Am I really good enough to do my own thing, or are patients just hyping me up?
There's ladies and there's men in my class who are gonna be doctors, and they're in my class.
Yeah.
I have to compete with them.
Get some sort of like business understanding or finance, accounting.
What made you want to start your own clinic?
Oh, make sure this person's coming 3 times a week or whatever.
Oh my God, this is so much more than I thought.
And it worked out. I ended up going to Ireland for 2 years.
Do you feel like you're a part-time therapist as well?
My wife told me I should go to a physio, so like I'm here as a result.
Even I ask myself, am I making sense right now? Wait, what? So, Shrusti, why don't we tell a little about yourself first?
Yeah, for sure. So my name's Shrusti. Currently, I'm practicing at Titan Physiotherapy, which is a clinic that I opened up about 3 years ago now. Yeah.
Was it, when you say you're independent, you own your own business now. What was your life before that?
I was practicing at different clinics, so it was kind of multiple clinics around the GTA. And kind of the idea then was just to get as much experience as possible, kind of learn from different types of treatment styles, different practitioners, work under chiropractors, physiotherapists, and like massage therapists, and just get a whole different lineup of techniques until I was ready to kind of do it on my own. Yeah.
No, I think that's the best way of going about it. I think for most people, the biggest question is that, I'm sure this is a sales pitch to anybody that's watching this, is that what makes you different from everybody else?
I would say the biggest thing would be, it's coming up a bit more now, but when I first started, kind of that hands-on approach and that exercise rehab approach with physical therapy wasn't as prominent. Now you'll see kind of clinics come up and promote that a little bit more, but when I started about 7-8 years ago, if you would kind of think of going to a physiotherapist or going to physiotherapy, you would just imagine being like hooked up to a machine for half an hour, maybe like a couple heat pads here and there. And that was kind of like the stereotype of the profession, which unfortunately wasn't a good one. And I felt like that kind of dominated the treatment style, yeah, especially in clinics kind of all around the GTA actually. And it was so hard even while I was looking when I was working, I couldn't find a clinic that didn't do that. Until like near the end. So yeah, that kind of really prompted, this type of treatment style and kind of being more hands-on and learning different techniques and all of that, yeah.
No, that makes perfect sense. Obviously we went to school together. For those who don't know, we went to the same high school, went to Harold Brathwaite together. Same grade 9 class, same grade 9 math class. Obviously we've come a very long way since then, right? And so since then, what was kind of your aspirations of why you wanted to do physio? Was it parental pressure? And it's cool if it is, because my parents forced me to do a lot of things I don't like, and that's totally fine. Or was it something you were passionate about, or you had an idea? And if that was an idea, what was that?
Yeah, well, I never grew up thinking I would get into this. I didn't even know what like a physiotherapist was.
You asked a grade 9-year-old, I'm like, what?
Yeah, in high school I had no idea. But I knew I wanted some sort of like health science related career. Mm-hmm. Funny enough, I wanted to be like an author. Super random.
Okay.
And then, yeah, it just kind of streamlined into some sort of science. But I would say more so in undergrad. Mm-hmm. I ended up doing kinesiology in undergrad.
Okay.
And usually people streamline into either med school, chiro, physio, usually one of those. And then I really just liked everything that physiotherapy entailed, because you got a little bit of that like patient interaction. You got quite a bit of that patient interaction. You had kind of the medical side of it where you're assessing, you're diagnosing, you're treating. So it's a good happy medium even in terms of lifestyle. Like you're not super stressed as you would be maybe as a medical doctor, but you still have that responsibility with the patients. You still get to have that one-on-one time and then go home and still have that work-life balance.
Like have a life.
Yeah.
No, I get that. I feel like most medical students are. You don't have post-life. It's just life at school.
Yeah, exactly. So yeah, there's no real plan in high school, mm-hmm. but things just kind of worked out, dropped into place. I was in the right kind of like undergrad at the right time. So yeah.
The reason why I asked the high school question is that like, if there's other high schoolers watching this, right, I'd be like, this is the time to look for your physiotherapist in your room. There's signs in the room that you can be like, that person's gonna be a physiotherapist. I'm just go find. I'm gonna befriend them.
That's so true. And I feel like high school kids now are way more educated
Way
in
more.
that. Like, what did
Oh
we
my
know?
God.
We knew of like 3-4 professions, and that's about it.
Yeah,
at that
lawyer,
time.
doctor, engineer, and then
Yeah.
accountant.
Yeah, and Korean civics barely like touch the surface of anything. But that's what I even tell a lot of like my younger patients that I see. They're so like, some of them are hyper focused into like going just into med school or maybe just even into physiotherapy. But I'm like, even within physio, there's so many different avenues you can go into. You can go into, like the way I practice, I'm in private practice, so it's more, I see more like sports injuries and your day-to-day kind of aches and pains. But you could do something completely different and just work in a hospital and basically live like that lifestyle of it, which is more like neuro-based and like crazy conditions that you'd see in that sense. So
We're gonna put a pin in that because
Yeah.
I got juicy questions about some of your experiences there. But in terms of school, you went to undergrad, and your undergrad was in kinesiology. Like, how was that whole experience from your undergrad, obviously post undergrad? You had to go to obviously, mind you,
school.
I'm not very like I'm unfamiliar with the medical school side of things, but I
Yeah.
imagine post university
Postgrad, yeah.
there was education there as well. Like,
Yeah.
what was that whole journey like? Once you understood, hey, you're in kin, right? You obviously made that choice for yourself when
Yeah.
you joined university. Where did that process take you to we eventually ended up in?
Yeah, so basically for physio school, you need some sort of a undergrad, like a science undergraduate usually. Yeah, basically from there, I applied to different physiotherapy programs within Canada and outside. I really wanted to do an international program.
Why?
Just to travel.
Okay,
Honestly. Yeah,
I'm for
really-
that too. I would have been down.
Yeah, and then like even a lot of the people that I knew and like within family and family friends had gone abroad, and that was just something I've always wanted to do, and it worked out. I ended up going to Ireland for 2 years, and the cool part about this program, because there's a big clinical aspect to it, so you get to see a side of it where you wouldn't really see if you're just traveling, like if you're there as a tourist. So that was super cool. I wish I got to travel more though during that time, but
If they put me in a business program in Spain, I wouldn't say no to
I
Barcelona.
know. Yeah, but that's always on the list to go back. But yeah, it kind of led me there. And then the program was accredited in Canada, so I didn't really have to do much when I was coming back in terms of making sure it was going to work here.
Same, yeah.
Yeah. So it was a very smooth process.
What was your experience like in Ireland? Did you feel like I'm sure it's obviously hard to say now because obviously you didn't study here in that portion,
Yeah.
but you know, if you have colleagues and you have people within the industry as well.
Yeah.
If you were to compare your experiences and what you've learned in Ireland,
Yeah.
because I mind you, the reason I bring this up is because you know I rarely ever hear anyone saying I went to Ireland for medical school or
Yeah.
like post education.
Physio school, yeah.
And so why Ireland in particular? Was there anything you learned differently there than you would have learned here?
Yeah.
Besides
Well,
the
there's
beer.
like 2 parts. Yeah. So there's 2 parts to that
Yeah.
actually. So the program specifically was accredited to the Canadian program. So
Okay.
that was a big factor. Whereas a lot of the other UK ones, they still had to like figure out the equivalency to that. So I kind of just wanted to skip that whole hassle. So that was actually one of the major reasons. And then was the second part to that again?
Was there like any teachings that were different outside of the box than stuff that you would learn here in Ontario?
Yeah, so they were very much like practical based, and they geared the program towards the exams that we had to give when we come back over here as well. Whereas from colleagues that I've spoken to that went to school here, the biggest difference was theirs was very theoretical, so it was a lot of like classroom-based stuff
application
and
almost.
textbook stuff.
Yeah.
They did you have to have clinical hours, which they did, but they found it wasn't as much. Like it was just very theory. So I felt, in our program we had a really good balance of both. Obviously, like there's things that could have been better in that
sure.
one too, but you're being in Ireland, you kind of
I'll take that.
let it go. Yeah, because either way for us, when you come back, you have to do like extra courses every year anyways. So then it kind of makes up for anything you've missed. Yeah.
As you mentioned Ireland, and I had exchange programs at university as well. Like one of my exchange programs was in Spain, and I was like, I wanted to go. I didn't end up going. One of my biggest regrets. The reason I bring that up is that there was for a student, obviously your first and second year, you're probably at this point you're probably looking at some of the opportunities you do have of being able to explore that. I lacked the knowledge, first of all. I didn't even know what to expect.
Yeah.
And just even having to pursue that. And so like for yourself, like how did you know that this was an opportunity?
Yeah.
What was the research you did? Like where were you able to find all these resources that helped you go find that, this is exactly what I need for my career?
Yeah, that's a good question because I I would say, again, for kids now, it's maybe a little
Oh,
bit
it's
easier
super
because
easy
it's a
now.
little
You
bit
just
more
put in ChatGPT, you're good to go.
Yeah, yeah. It's a little bit more popular for people to go maybe like somewhere else and do schooling. But at that time, and they would have it now too, but within our undergrad program, they would have people from different universities come and do a little presentation. And actually someone had come from that specific university in Ireland, one of the professors, and she had done this little like talk on the physio program there. So that's kind of when I even realized, okay, this is one country to even look at. Otherwise, everyone knows about the UK and all the programs there. So that really helped. Secondly, a lot of, like my sister went abroad and studied, and like a lot of family friends that I know did. So kind of got some insight from them as well. So definitely like networking helps. Even kind of being part of certain maybe clubs in undergrad and all that can help as well. But I think, again, I was in the right place at the right time.
I think that's the biggest takeaway for a lot of
Yeah.
things in life, is just being there at the right time,
Yeah.
right place. Before we change topics and we get into more of like the nitty gritty of like what you do on a day-to-day basis, was there any advice you'd give to students, that weren't sitting in your shoes in university, like, they're in kin, and kin, as you said, ties into a ton of different topics. You can go into medical, you can be a nurse. There's just so many things you can do.
Yeah.
And so, if someone who's interested in pursuing something like you have right now, in physiotherapy, what would be some of your advice in school?
Yeah, I think the biggest advice I could give to someone that's currently in undergrad, especially within a kin or health science program, it is probably not to start off so narrow in your vision for what you want to do afterwards, because it may change. And again, there's things you'll learn along the way, even maybe once you're in your master's program or doctorate, whatever it is, that might streamline you to something else. So if you kind of keep it a little bit broad in the beginning, you'll allow yourself to kind of go into different avenues. So again, even if we're very specifically talking about physiotherapy, within physio, like I was saying, you can work in a hospital or like sports setting, or you can do like athletic therapy type stuff. I find people even streamline themselves a lot in the very beginning, right when they start their career. And I kind of did that too. But I would say maybe just like do more research about just the different like avenues that either can take you, or the professions within that. And then kind of like get your foot in the door to all of those, and just maybe either work in certain places to get some experience, volunteer, talk to other people, because you may end up liking that more than maybe what you initially had set out to.
100%.
And it's not a bad thing.
The reason I bring this up is like I thought about this even two things. One, I remember, I had a few friends of mine also in kin, they were kin students as well, and they would always tell me, hey, there's guys in my class, there's ladies and there's men in my class who are going to be doctors, and they're in my class.
Yeah.
I have to compete with them on these exams. And I can feel like the intensity of like, why are they in my class?
Right, that makes sense.
And I just wanted to fix muscles, and there's like legitimate doctors sitting beside me, and so I thought it was super funny. And I don't know if that holds weight until like your experiences, but like I remember that was always talking about life. So an engineer sat beside me, and I'm not an engineer, and I'm in some sort of a joint program. I'd be like, well, why are you in my class?
Oh, that's so true.
So yeah, I just wanted to bring that up because I thought it was super cool. Because someone mentioned this on an ongoing basis while we were in school. That the dude is a doctor in my class. He's a 98. Why is he here?
That's so true. I think imposter syndrome.
Yeah,
starts
no,
early,
for sure. Immediately,
right?
you'd be like,
yeah.
But is there a doctor here? Why is he?
Exactly. Yeah. So right away in undergrad when you start comparing with peers. But then again, you can see there's so many different paths within that, right? You can even just major in kin, and that's a great career now. Or you can go into something completely different that could be more business related. I know people that work in insurance companies as a kinesiologist. So like you would never think initially.
I totally, you can be an insurance. Yeah,
no. Exactly.
That's crazy.
So I think that's completely fine. And again, imposter syndrome literally starts super early, and you can start doubting yourself even once you're in the profession. So that's something you're kind of constantly dealing with. And
I think that applies for a lot of things too. I remember just as we're talking about this conversation, like I've had business law as a requirement for my undergrad as well. And it's a contract course, right?
Yeah.
It's just basic contracts for business students. There's actual law students in this class.
Wow.
Like actual law students. And I'm like,
do I belong?
Like, first of all, we're only learning one chapter of contracts.
Yeah.
They're like getting 90s, obviously. I'm sitting here, I'm reading the same sentence 15 times over, and be like, do I need to know this? Is this required?
That's us with physics. We had to take physics for 2 years, I think, in
Oh
our
my
undergrad,
God.
and like I knew nothing. Like, I remember my grade 12 teacher promised me not to take physics ever
My
again.
grade 10, but I didn't even get to that level yet. Grade
Yeah.
10 science, I think it was Miss Kasha. So, Krish, if you promise me right now, if you will not take science after grade 10, I will pass you. I was like, do we have, where's the paper? Let's sign it right now.
God.
I'll put my blood on the line right now. I do not
You're
want to
like,
do
don't
this.
worry, that's not happening. And look at where you are.
Yeah, no, I'm a podcaster. Cool. So you obviously own your own clinic now. So let's talk more about that.
Yeah. So like I said, it's been about 3 years now. I would say in a way on and off because I was kind of like focused a lot into it initially, and then we moved and shifted focus. But this year, hopefully planning to do like bigger moves with it. It's a whole different side of the career, even having to do every part of it yourself. Rewarding in many ways, but also a lot of work with the whole business aspect of things, which actually going back to the question about advice I could give, no matter what profession you're in at the moment, I would say like get some sort of like business understanding or finance, accounting, some sort of understanding of that, because obviously it's literally going to apply to every and any profession that you're going to end up in down the line. And that's something I definitely didn't do. I was horrible at math. Yeah, as I said, physics. So that part was always a little bit tough to understand. But obviously having your own business and practice, you do have to have some sort of understanding of it. And it is a learning process, but I would say that's been like the biggest challenge of it all.
Would you say if you're in school, if you were to go back 10 years and you're back in your undergrad, would you tell your younger self, hey, start taking an accounting course, take a finance course?
Not even undergrad, like high school. You know how we had electives?
Yeah.
I would fill
Took
those
art.
with anything but that, but I would at the very least get the basic accounting course I think we could have taken. Start with that at least, and then definitely at least 1 or 2 in undergrad, and then just kind of ask more about it. Even once I was in the profession, I should have been asking my colleagues and stuff. But that's something, again, I realized once I actually started the practice. And I was like, oh, numbers matter. And like this matters, and patient requisition and all that kind of stuff. So yeah, that was.
I'm gonna ask you a spicy question. So this is gonna come for the heart. What made you want to start your own clinic?
I think kind of I wasn't seeing what I wanted to in the clinics that I was working at in terms of how I wanted the physiotherapy practice to look. I wanted it to be very collaborative within all the practitioners. Again, I wanted more of that like exercise rehab and manual therapy to be a big part of it, which, a lot of clinics at that time at least were still focused very much on like just using machines and very much it was more of a business model where, it's like, oh, make sure this person's coming 3 times a week or whatever. And I was never about that. It's more about getting people to feel better as soon as possible. And, I wasn't looking at the number side of things in that. So, I really felt like having my own practice would allow that to happen where like organically it could grow because people would see that genuinely. Like I'm not telling them to come back because of their insurance plan that has like maybe $1,000 for the year, but it's legitimate because like they need it for X amount of times. And I've seen it translate to that. Like I do get a lot of feedback where even patients have said that they don't see that in all of clinics right now. So so that was, I would say, the biggest thing that was missing.
Yeah, and for those who don't know, she's actually my physiotherapist. She takes care of me most of the time. I mean, most of the time. The other half of the time is just me not coming. So I don't blame her for any of that. She goes to show you.
You said it, not me.
I guess the biggest question, I think, for most people, just being in the field of having your own business and just, being your own boss, what's it different being like a practitioner? Like from being just an employee, obviously you don't have to worry about any of the nuances between running a business.
Yeah.
And then obviously being a boss is very drastically different.
Yeah.
And so from a physiotherapy standpoint, what were some of the nuances between the two?
Well, I think, again, having your own practice, you get the flexibility of time. So it was nice to well, it comes with, actually, it's a double-edged sword. So, when it comes to maybe taking time off or booking vacation or anything like that, it's very easy in that sense. You can just block it off and you're good to go. I don't have to wait for approval. But then the downside to that is the time that you're not there, you're not getting paid. So, there's that. That was one thing. And then the biggest that I mentioned was the whole like numbers part of everything, just, making sure the business side of everything is running, whether or not, even if I'm there. So I have to do the marketing part of everything, the social media part of it, and then just like the actual clinical side of things, where you have to keep up with notes and all that kind of stuff. So yeah.
Yeah, I can imagine, especially dealing with clients that don't do homework. You have that too.
That's most.
I try. I honestly do try. It's just sometimes I forget, and then I end up showing up, and then
You're good.
You're good. What's kind of the scariest moment for yourself as you started this? Like, what was the biggest, like, oh my God, this is so much more than I thought?
I think when the imposter syndrome again kicks in multiple times, where it's like, am I really good enough to do my own thing? Or are patients just hyping me up? It's like, why can't I just work at a clinic that does something similar? But I think I've always had that drive. I never, when I first started in practice, I never started to be like, okay, I will eventually start my own clinic. But I would say it kind of organically happened as a couple of years went by. I'm about like 7 years in to the profession. So the first couple of years, it was very much like, I just want to absorb knowledge and just learn from people. And then eventually, naturally, I just had that drive to do my own thing. And I think just have that flexibility in schedule. And you have to think long term as well. Like, it is a physical profession. So, one of the daunting parts is will I be able to do this when I'm 60 or, 50, whatever it is. So I think with that, naturally, it was like, you can have more autonomy having your own practice. So I would say that was the biggest thing. In terms of what was the most challenging in all of that was literally learning the business aspect of it and not doubting myself.
I think the doubting yourself is everybody, I think. I think I mentioned in the previous episode, you got to fake it till you make it. So I think it seems pretty evident so far as well. So you mentioned right now the longevity of your job, right? You play a role that is, I wouldn't say strenuous on your body, but to at least a reasonable degree that you do physical work, right? And so as time progresses and you have a very good understanding of the body. And so like, where are some challenges down the road that you see happening in the future?
With the clinic? Like, what do I see happening? So I hopefully this is the year, hopefully next year, where I can expand it and just have more practitioners and have people that are aligned in how I want to practice. And hopefully that's what they're looking for in their profession, but just have a larger team. And then hopefully I can kind of step back a little bit and then do more of like just the management side of things rather than too much of the clinical, and then have that balance. So that way you don't burn out.
Oh, for sure. I think burnout is the scariest part of any job, right? And once you feel like you're out of it, I think it's very hard to come back from that feeling.
Yeah, exactly.
But as we're talking about this, I feel like there's a strong demand, and correct me if I'm wrong, for education around just running your own business and just that side of, even just physiotherapy in general. Like, it feels like there's a demand for it, because I feel like people, when they go for it, they have the knowledge of like what they're good at, which is the medical side of things. You're really good at that, but the other side is accounting, marketing, finance, the payroll, there's benefits to that. It's daunting. I think there's a strong need for business across the board, because it feels like you're obviously phenomenal at what you do, and I can attest to that, and great at what you do. You obviously come super experienced. You come from a very specialized stream of education. But the other side of the coin is just finance, marketing, the whole taxation, the benefits, HR, if you will. And I don't think anyone teaches that. And it seems like there's a great business need for this.
There is.
Right? Could you imagine someone just giving lectures and be like, well, if you're opening a business, here's what you don't know.
Yeah. And like specify that to the healthcare field. I remember when I first started, I was like, is there a healthcare accountant? Like someone that just works with like chiros, physios, RMT. And Googled it, couldn't find anything. And everyone I knew, they're like, that doesn't exist. But hey, any
Maybe you
accountants
should.
watching,
Yeah.
yeah, you guys should just specialize in that.
Yeah, if you're an accountant right there, if you're listening right now, if you're an accountant, you just heard it. You heard it right here. Cool. Well, I guess I should probably talk into some of the more personal stuff that you encountered, right? You don't have to tell me like explicit details of exact events. You know, you've dealt with a lot of clients, including myself. What is the weirdest injury someone's come in with?
I was thinking about this, but I'm sure there's weirder
Sure.
ones. I can't even say this is weird. It was just kind of like unexpected the way it presented.
Okay.
But I'd say because of the setting that I work in, you're not going to see like extremely crazy things. I'm sure if you're in hospital working as one, like you'd see some crazy traumatic injuries. But I would say the weirdest one was like someone that had a fracture in their hand for a whole year and decided to. Basically, they had pain in their hand for a whole year, didn't know what it was, and then finally came and saw me, and I just couldn't figure it out. I was like, all the tests are negative, like nothing's showing up. Like, how did you have pain for a whole year and it didn't get better? But yeah, it ended up being like a carpal bone fracture, which not that it's uncommon, it can happen, especially with
Where
falls.
is that exactly?
It's like one of the smaller bones in your
Okay,
hand. But it's just unexpected to see someone come after a whole year. Like usually with that kind of stuff, you're seeing within a week or two, at the very least, maybe like a month. But a year was very unexpected, and I was just like, whoa, almost
good?
missed that. But luckily we caught it. Yeah.
And this person was completely fine for most of the part.
Just very nonchalant about it. Yeah, so then normally you'd be like, oh, someone would be in a lot of pain, or
Yeah.
at least like more of a complaint. But this is like, yeah, you know, I was
Up at
told,
basketball.
my wife told me I should go to a physio. So like, I'm here as a result. I'm like, oh, okay.
Well, this goes to show you gotta be married to take care of yourself.
Apparently.
In terms of your like, you know, you've treated a lot of people, right? And while you're treating people, do you feel like you're a part-time therapist as well?
I would say that's a big part of the job. It's entertaining, that's for sure. You do, that's something I didn't know getting into the field would be a big part of it. But it makes sense. We're spending sometimes a whole hour, at the minimum half an hour with patients that you're seeing fairly regularly. So things come up, conversations come up.
You're just like, okay.
I think it's made me a great listener.
Yeah.
And you know, we can't give advice and stuff, but that's why I mean it's made me a really good listener. It always keeps things entertaining. I learn so much from my patients too. But yeah, there's always some good stories that I have afterwards.
I'm not gonna lie, if I was you, I'd be like, I'm not a licensed therapist, but if I was you,
Yeah. I'm like, hey, maybe I'm actually good at this. Like the other
maybe we
part
should
of
add
the
like that
therapy.
little part of your package.
Right.
You know,
Right.
if
only we could. If only we could.
Well, you can't.
No.
Oh, okay. I thought it was just joking.
A lot of restrictions.
Okay, never mind. Because that would be pretty cool. Like, you get an hour of physiotherapy, but then you get 20 minutes of actual therapy simultaneously.
Imagine. You're already lying down.
You're already lying down. I got you.
Yeah.
And it distracts you from the actual stuff that's happening.
It's like the hot sauce challenge.
Yes. Oh,
Yeah, except this is like physical pain, and then you get them.
That's
they say
devastating.
things as a result. So yeah.
I don't think I'm at the age where my body can handle hot stuff like that anymore. But I think the largest thing, and this is for personal experience as well. I think this is something that I found super intriguing when the first time even seeing you, even just recently, me just not breaking, but like I have multiple things wrong with me. I have shoulder problems across the board. And me telling you like my symptoms is like, it's crazy to me because I tell you all kinds of things that I have no idea what I'm talking about. Little do I have zero understanding of the human anatomy. And you somehow figure out exactly what's wrong with me, how it is, and you're able to give me a visual representation of like, this is what might have happened to lead to said injury. You know, when you hear other people tell you like their information of what happened to you, would you be like, you're lying to me?
No, not at all. That's a big part of actually the whole assessment part of it. It's called, like we call it the subjective assessment. So that's literally just listening to the patient and having them describe what's going on, which is where a lot of the things are missed usually in like when they maybe go see their doctor because of time limitations. They'll maybe get cut off a little bit too soon. But we have the leisure of time, I guess, in this kind of therapy. So as you were saying, a big part of the assessment is literally like having the person just explain what's going on. And that's a big part of the diagnosis too. That's how we kind of come to it. But yeah, if someone's like faking it and then like that doesn't match the physical symptoms that we're checking, that can get a little bit tricky, but that doesn't happen often.
Yeah, no, the reason why I ask this is because like I'll use myself as an example, right? Like I'll be like, hey, my shoulder hurts, but it only hurts when I move it this way. Does it hurt when I move it this way?
Yeah.
Oh, it's just there's such unique nuances of like what part hurts in my shoulder or like how I move it. And to me, right, as a person who's not in the field, I sound deranged. Right, I'm just saying things that I don't even I ask myself, am I making sense right now?
Yeah.
And then you're like, yeah, no, you're perfectly fine. Here's what I think, and you do a couple tests on me, and I'm like, well, how did you figure that out with the gibberish that I was?
Yeah, I think also experience comes with that too. I remember when I first started, it's like you get so overwhelmed. You're like, this person is coming in with like their neck hurts, their back hurts, and then like shoulder. How do we focus on one area or figure out where to even start with that? But I would say that part is experience, but they do teach us a lot, even just within like physio school, how to start with the assessment and kind of like break down what the person's saying. And every patient thinks they're being super random when they're coming in. But all the little details help a lot.
How did you navigate that early on?
You just have to practice it.
Go with the
That's
punches.
the thing, yeah. The way it's kind of made is interesting because when you start off as a physio, you're a resident physio, so you're working under another one. So you kind of you learn and you watch and you learn literally. And then you realize things aren't so textbook, which is where it gets a little bit tricky. So symptoms may not present as what you've learned. And that's where experience kicks in. Over time, you see multiple different conditions or cases coming in, and you see the similarities between all of them or the differences that make it a little bit easier. But also this profession is changing so much. Like there's so many things coming out, even studies and stuff where certain tests we learned maybe 7 years ago, they're not valid anymore. So things are constantly changing and you just got to keep up with it. That's the hard part too, actually. Just keeping up with it.
Yeah, it's very similar to like even lawyers as well. I remember even lawyers that go back to school just to not relearn, but like to learn new like bills that have been passed, new laws that have been passed.
Yeah, that's actually so true. I guess in every profession there's a little bit of that continued education, but that's what keeps it interesting too. Like it's never a dull day. It's not your regular 9 to 5. Even with patient stories, there's always something interesting there. Conditions are interesting. If it's something I haven't seen in a long time, it's like, okay, let's look this up again. But yeah.
As we kind of wrap this up, and as we're coming close to the very end of this, I had a few questions for you, but one more so takeaway from the audience here. Wait, what is one piece of advice you would give to people who are looking to pursue a career in physiotherapy? As you said, there's multiple different avenues that break out into it. You could work in a hospital, insurance company, have your own practice. What would be one piece of advice? And if it's more than one piece of advice, the floor is yours.
I think if I had to just sum it down to one piece of advice, like actually be good at what you're doing, right? Like it's a profession where you're working with people and you're treating people and they're putting their faith in you. So before even thinking about starting a clinic or whatever, maybe like hone your own skills first and then think about everything else. But it's simple. Just, I guess, be good at what you do.
Is there a piece of advice you would give to a younger version of you?
I think going back into the accounting side of things. Don't be so focused on only being good at the science part of everything. It's good to have multiple skills or at least a basic knowledge of different parts of life or career, I guess.
And the last piece of advice, more so for myself, what would you give me?
Advice for you?
Yeah.
As a physio or just as?
Just as someone who owns their own business.
I think just keep at it. Don't doubt yourself. You're really good at what you do. And you're great at talking, great at speaking.
Stop it, you.
So just hold on to that and expand with that. Yeah.
No, I appreciate that. I'm not saying this to ice me up on the episode. I just wanted some proof. Thanks, Rusty, for being here.
Thank you for having me.
I will see you guys next week.